Hi, I'm Chris. I'm one of the podiatrists at Foundation Podiatry. In my spare time, I also do a little bit of running coaching. I wanted to do a couple of videos on some of the risk factors for developing a running injury. Running is one of those activities that has grown tremendously in the last decade with participation, and I guess with that increased participation it means that we are seeing more and more running related injuries that are coming through the door. It can be a really frustrating thing when you have been getting into your running to get injured, and so I guess what we are really wanting to try and do is prevent those injuries, or at least try and recognise some of the early signs for when an injury is preventing, so that at least it means that you're not out from running for too long. So I guess when we are looking at those risk factors for what can make someone more susceptible to getting an injury, risk factors mean, I guess, that it doesn't mean that you'll definitely get an injury if you have one of these risk factors, but certainly if one or two or three of those risk factors are present, it may mean that you're more likely to become injured. So I guess one of the things that we know about running injuries is that first of all, they're very frequent. They occur usually at a rate or at an incidence of around 50%, which means that 1 in every 2 runners are injured at any point in time. And that is a pretty high statistic. So it often means that if you are running, that there's going to be at some point in time a time that you are suffering from an injury of some sort. Generally with running injuries, they are much more related to that repetitive strain or what's called an overuse injury. So something that builds up over time essentially, and so sometimes those small things that can be occurring on a frequent basis can then mean that we're leading to injury. So some of the injuries that do occur more often than not, so certainly the knee is a common site that will get injured. A few different conditions that can occur around the knee. The more common ones are patellofemoral joint pain or pain around the kneecap, around the front of the knee. Other conditions include things like ITV friction syndrome, which is more towards the outside of the knee, and that sort of feels like it sort of builds up over the run that you're doing. Might be aggravated by going up and down hill or up and down stairs a bit more, and certainly can be really quite painful and debilitating. Other areas that get injured more often than not are the lower leg, so muscle injuries, stress fractures, things like shin splints. But also then the foot. The foot is the other area that commonly gets injured with running, and I guess it makes sense. When we're running, we've got huge forces that go through our joints, and our foot is the first thing that hits the ground. So if those forces are really high, then that can certainly lead to that build-up of that progressive overload or that progressive injury. So knee, lower leg, foot certainly makes up the most common sites for injuries with running, and that's actually fairly well reported in the research that's done on running. There's lots and lots of research on running because it is such a popular activity and it has grown so much in that popularity over the last few years. I guess the other thing is that when we do get injured, it can mean that we're out for a long period of time. So we definitely want to try and make sure that we can identify the early signs of injury, so that the sooner we get onto that, the better. One of the key things that will put you more at risk for an injury, unfortunately, is a previous risk of a running injury. So that means that if you've been injured previously, you are actually much more at risk of getting injured again. I guess it kind of makes sense to some extent, but it certainly shouldn't stop you from getting out there and running. The other thing that can put you more at risk of injury is if you're new to running. So if running is something that is new to you, so if you have less than 2 years of experience in running, you are far more likely to get a running injury compared to someone who's been running for a bit longer. So I guess the only way to get around that one is to become more experienced, which means that you are running consistently, and consistently actually means that you're attempting to run several times a week. Up to 3 times a week is actually what's considered to be a fairly good number to aim for, which is sort of putting you in a risk group that is not too high. So if we are running more often than 3 times a week, particularly with having less experience with running, then we're more likely to be at risk. On the other end of the spectrum, if you're an experienced runner and have been running for some time, in fact it can be protective to run more often than 3 times a week. So I guess like anything, there's not one rule or one set of rules that fits everybody. It does depend on a lot of things. And in the next sort of series of videos, we'll just talk through some of the other risk factors that are there, including your alignment and your biomechanics, as well as other things like training and training errors. And we've got some videos as well on footwear and equipment to see what sorts of differences there are there with those types of additional risks.